All right, good afternoon, and I'd like to welcome everyone to this virtual press conference. I'm joined this afternoon by Dick Anderson, our county manager, and Dr. Pamela Rochelle, Deputy Chief Operating Officer for Health and Human Services. And they will do most of the talking this afternoon. But let me begin by stating that at the April 1st meeting of the Board of Commissioners, your Fulton County Board of Commissioners unanimously, all 7 of us voted to approve what I consider to be a historic piece of legislation. And that piece of legislation approved to put in place $10 million to be used to provide relief for many of our most vulnerable citizens during these very difficult times here in our county. The money is to be used in 3 broad categories. Number 1, senior services. Number 2, assistance to our homeless community. And number 3, small business loans, including our arts groups. The other unique thing about this whole effort, from my perspective, was the fact that we voted mid-afternoon on April 1st, and by Friday afternoon, the contracts had been signed and checks had been cut. And this morning, the first recipients, picked up their checks. Our one caveat was that this money needs to be used quickly, immediately, because our citizens are hurting and need this relief. So with that being said, I'd like to turn the press conference over to Dr. Pamela Rochelle.
Thank you, Mr. Chairman. So I am very pleased that we have been joined by several of our partners that will really hit the ground running and provide much needed relief in the community. Specifically, what we've heard from our stakeholders in the community is that they are being overwhelmed with requests for financial assistance by way of rent, utility, and mortgage assistance, as well as assistance with food requests. And so today we're joined by the partners who, as Chairman Pitts indicated, are our first round of partners who were funded today. And we have Antioch Urban Ministries, Reverend Hightower, Buckhead Christian Ministries, Kiva Case, Community Assistance Center, Tamara Carrera, Hosea Feed the Hungry and Homeless, Elizabeth Omalami, Midtown Assistance Center, Jennifer Jobson, and North Fulton Community Charities. We're joined by Holly York. These are all the CEOs of these organizations, and they really worked hand in hand with us to stand up this partnership in record time. Before they speak, I'd like to turn it to our County Manager, Dick Anderson, for some additional remarks.
Well, thank you, Dr. Rochelle. And I think I would just not only echo what the chairman said, but provide a little bit more detail. So our focus is really on speed as well as trusted partners. And I think today's press conference will underscore both of those. He's already mentioned that 1/3 of the dollars have been allocated within days. And part of that, which we'll be talking about today, is through trusted partners. And I think that's what's made this so easy to do. We know these folks, we've worked with each of you. And again, it's great to rely on you at this point in our community's unprecedented set of needs. In addition to these, what we're also doing is working with other partners. One is with Mercy Care, with testing that will be provided to our homeless shelters, 100% testing in those shelters, which we think is extremely important to do, and to do again quickly. And then the other is a comprehensive small business loan program working with ACE. And ACE is a firm that's been around for a number of years, has offices here in Fulton County, has loaned out about $70 million or so in loans to disadvantaged businesses, minority businesses, and the like. And we found them to be a perfect partner for the $1.5 million that the board also allocated for small business loans. So while today's focus is on these specific entities, the broader is we're doing many things, 1/3 of which has been done in the week preceding, and then 1/3 in each week thereafter. And I think, again, that's exactly our board's intention. So Dr. Rochelle, let me turn it back over to you for discussion of these specific partners.
Thank you, Dick. As the county manager mentioned, we also are joined today by Tom Andrews. He is the CEO of Mercy Care. And so let me just kick off the discussion there. Tom, thank you for joining us. Can you tell us a little bit about how you are going to partner with Fulton County to meet the testing needs, especially in the congregate settings of the 5 shelters in Fulton County?
Sure. Thank you very much. And Chairman Pitts, thank you and Fulton County Board of Commissioners for really giving us a shot in the arm to be able to do this. We're really excited about it. We're teaming up and partnering with the CDC, and they're actually going to be providing 10 deployed physicians to help us with this effort because it's a pretty heavy lift. But we're going to be testing 6 of the largest shelters starting this Wednesday, and we hope to complete that within 2 weeks. It's going to be about 1,300 homeless individuals who are in conjugate settings. And of course, we know we've already had some positives from a couple of those shelters. So this effort will really do a lot of good to mitigate the possibility of any additional spread of the virus within those settings. Of course, the most important part is that we have teamed up with Partners for Home as well. And so when we identify through DPH, we'll notify them of all the results, and DPH will arrange with the shelters to transport any positives to the isolation center that the city and the state is standing up, which is really important because it, again, mitigates any additional spread of the virus. So 6 shelters in 2 weeks, 1,300 homeless people will be, in fact, tested. And then after that, we're going to continue to test. We're going to focus on people that are in the encampments, people that are living under the bridges and in the streets. Our outreach teams and Partner for Home, our outreach teams will be identifying the most vulnerable ones and getting them to our testing centers.
Thank you, Tom. So now we'll move to the Midtown Assistance Center. Jennifer Jobson is the CEO there, and Jennifer shared that they have seen over a 75% increase in the number of requests that are coming in from impacted constituents due to coronavirus. So Jennifer, share with us how your agency is going to help constituents by way of financial assistance and food.
Thank you again to the commissioners of Fulton County for acting so swiftly to get this money into the hands of organizations so that we'll be able to start meeting these critical needs. The assistance requests are increasing every day. We plan to use our funding from Fulton County during this emergency to reach out and pay rent, mortgage, and utility bills for more than 1 month for folks that have been affected by loss of income. And it's sudden loss of income due to the COVID crisis. Predominantly, we'll be doing financial assistance, so we'll pay more than 1 month of rent and utility bills and pay it forward. We will also be using the funds to purchase grocery store gift cards, which can be mailed directly to our clients in need. And for those that are at an at-risk population, we will be setting up Instacart grocery deliveries so that they will be able to continue to shelter in place and not be at risk by grocery shopping. But we are so grateful for the opportunity to be able to meet the increased needs for Fulton County. And thank you so much for acting so swiftly.
Thank you, Jennifer. Now we will turn to Buckhead Christian Ministries. Kiva Case is the CEO there. And Kiva shared with us that he has seen thousands of new callers calling, asking for assistance and wanting help and more information. And so Buckhead Ministries stepped up, and we're pleased to partner with you as well.
Absolutely. Thank you, Dr. Rochelle, and thank you, Chairman, and the rest of the board for stepping forward with us. It's true. From March the 2nd to March 28th, we pulled our call logs, and we had 120,000 calls, which amounts to about 5,000 calls a day, up from about 700. And even when it was just 700, that was too much. So the demand is surging, and we were thrilled to have this opportunity, to have the ammunition to go to battle against this pandemic and the ravages that it is exacting on our community, especially the working poor. So for us, what we're seeing primarily are job loss, hours cut, child care being a challenge, increase in domestic violence and child abuse, digital and financial abuse. The majority of our calls are all COVID related. The bills, although rent is evictions are being forestalled right now. Bills are piling up, and so we need to get those tallies down. There are unique challenges that our clients are facing, such as leasing offices being closed and having a tough time getting access to documents. And so the way that we're going to utilize this funding, and we've kind of framed this in three priorities, is that we're going to focus on what we do best, which is direct rental assistance. We're going to have flexible guidelines. We're recognizing that the realities have changed, that people need more than 1 month, and that we need to focus on those impacted by COVID first. And it's not just us operating remotely. Our clients are also operating remotely, which can make case management a little bit tougher. So we're having to be flexible in those guidelines. And finally, we're committing to transparency and sharing with our partners all of the realities that we are facing as an organization and that our community is facing as well. I'm thrilled that you have stepped forward, and some of our partner churches and foundations and funders. So thank you.
Thank you, Kiva. So now let's turn to Antioch Urban Ministries. Reverend Terry Hightower is joining us today. And can you tell us, Reverend Hightower, how the surge has really impacted your demand? I know you're seeing more demand for food. You're seeing already some requests for rental assistance. You're tying in all of your other ancillary organizations to help, like your substance abuse shelters. Can you tell us how Urban Ministries is going to step forward here?
Yes. First, let me say thank you to Fulton County for stepping up and making this possible. I want to also acknowledge that Reverend Alexander, who is the chairman of Antioch Urban Ministries, is on this call as well, and he was actually going to address these things for us today. Reverend Alexander, are you still there?
Yes, yes. We want to say thank you, Chairman Pitts, and thank you, Dr. Rochelle, and thank you, Dick Anderson, and thank you, Fulton County. We've seen a lot of negative impact from COVID-19. Probably 90% of the phone calls that we're getting are requests for food and requests for financial assistance. We have members and people in the community who are calling. I really look forward to having a conversation with Tom Andrew. I have members calling because they've not been able to see doctors. Doctors and hospitals won't let them through the door. And one member in particular has been at home quarantined for about 3 weeks, but she's had a loss of income and cannot substantiate it medically. So we're seeing it on both sides. On the food bank side, there's been a tremendous increase in the need to the degree that Antioch Urban Ministries' main partner or main source of funding is Antioch Baptist Church. And so the church had dipped into some of its savings just to help out during this crisis. But the need is great, and it continues to grow. At one point, the Atlanta Community Food Bank was concerned about its resources. And so Reverend Hightower and I started a plan, but we just started buying food directly from the grocery stores, those who would sell in bulk. And so this is going to help us tremendously. And thank you for your quick action on this. We're still housing people who are HIV positive, and we're housing men and women recovering from substance abuse. And so this helps tremendously. So thank you. And we're praying for you guys who are still on the front line. And thank you for making this happen so quickly.
Thank you, Reverend Alexander. Let's move now to North Fulton Charities and Holly York. I know, Holly, your organization has been impacted. Your thrift store, you're unable to receive the revenue from that. You've had hundreds of calls for financial assistance. Can you tell us how North Fulton Charities will continue to operate in this new world order, so to speak?
Definitely a new world order. We have the first half of March, then the second half of March, and then the last week of March, and we've really taken a hit. We have seen a 320% increase in the requests for assistance. When we may have received 100 requests in a week, we've received so many more. Just last week, we just are now on a weekly basis. 80% of the people that are coming in are asking for assistance for the very first time. So they have never had to ask for assistance before, but we are opening our doors. We have gone remote. We are using this amazing amount of funding to stabilize as many people as we can. We call it financial assistance. We can go further, faster for our families in Fulton County with this money. So far, we've already stabilized over 100 families, and there'll be a lot more to come. We also are seeing an increase in the amount of assistance that they need. When before we could partner with perhaps St. Vincent de Paul or another agency to do a full month's rent or housing, we are moving toward a full month's. When it may have been $700 average, we're now well over 1,000 to stabilize these families.
Thank you, Holly. So let's keep moving. Let's speak with Tamara Carrera from Community Assistance Center. She's the CEO there and is mobilizing, continuing to mobilize her team to respond to this tremendous demand.
Just 1 second. I think she just stopped it.
She's not in.
Tamara, are you there?
So while we reconnect with Tamara, let's move to Mrs. Omalami with Hosea Helps.
I don't think she's on the call.
Is she on the call yet?
Our loan partner is on the line, Access to Capital.
So now we will move to our loan partner, Access to Capital.
Yeah, I got it. Access to Capital.
There you go. Am I off mute now?
Yes.
Yes.
Okay. I'm Grace Fricks, and I'm the founder and CEO of Access to Capital for Entrepreneurs, or ACE. We're a private nonprofit, which means what we do is put our mission of helping underserved business owners expand and grow their businesses before we put any kind of profit. Right now, I think all of you know that small businesses are suffering, and Fulton County has many, many small businesses as well as sole proprietors. And so we're stepping into the gap right now with the funds that the county is providing, and we're very grateful for that. Besides businesses closing, I mean, that's how they make a living. So they can't pay their employees themselves, take care of their families. So it has a ripple effect. And what we are going to do is we're going to provide loans with very generous terms. We think with the money that you're providing, we're going to be able to provide at least 30 to 50 loans, depending on how much the business needs. The loans will go up to $50,000. They will, for the first 3 months of the loan, the interest will be deferred, principal deferred, no payments. The next 3 months, the interest will be deferred. And then the last 30 months, they have 36 months to pay it back. Then they'll have principal and interest that they repay. Part of what we do is not just provide capital to the business, but we provide coaching and connections. So the coaching aspect that we are providing is one-on-one to any of these businesses that receive these loans. And that means helping them look at their cash flow, helping them determine what other kinds of vehicles they need. As you know, the federal government has put out 2 different types of loans and forgivable loans. And so the borrowers and also anyone in Fulton County will be able to go through our website and be put into connection with our Women's Business Center or with Morehouse College's Innovation and Entrepreneurship Center. And between the center and our Women's Business Center, we will provide the business owner with counseling to help them determine how to apply for the federal programs. So we see this as a bridge. We think that providing loan capital, some kind of help for the first 3 to 5 months is going to help solidify them until they can get back on their feet. Thank you.
Thank you. Has Hosea Helps been able to join us? Let's go back to Ms. Carrera with Community Assistance Center.
Let me see if she's back. Here we go.
Tamara, are you able to hear us?
Now I am. Before I wasn't, but I am fully connected now.
Thank you. Thank you so much for joining us. I know your story is similar, the surge that you're seeing in demand for food, for emergency assistance. Can you tell us a little bit about what you're seeing and how Community Assistance Center will be assisting Fulton County residents?
We started seeing this as soon as the shelter-in-place order, and actually a little bit before, some of the businesses had already started to close. So we started receiving phone calls, I would say around the 12th, 13th of March. And the increase in just the demand on phone calls was over 400%. Right now, the increase in request for assistance is 3 times as much as we normally would do. We're only into the first week in April, and we have already committed over $80,000 of rental assistance for families. And we have probably about as much in the process of being processed and documented. So the increase is huge. Our food pantry, which is the one part that we are actually working on the ground, everything for financial assistance is being done off-site, online and electronically, for 2 reasons. Number one, obviously the health reason. And the second one is because we can process that a lot faster without the clients having to be exposed physically to the possibility of getting the virus. So we are, I was just checking right now what our demand for calls are. And just this morning, we've received 50 calls. Those are additional calls that we will be processing in the next couple of days to see what is coming up. But it's going fast. More and more people every day are requesting. So obviously we're getting as much help from the community as possible. We work out of 3 different sites, 2 of them in Fulton County, 1 in DeKalb, and every one of them is at full capacity. For food distribution, we have moved from a supermarket mode to a prepackaged mode to minimize exposure, both to the staff and volunteers, but also to the clients, and obviously following all of the CDC recommendations. And we're delivering to high-risk people, particularly the elderly. So we're delivering twice a week to Hellenic Towers and Allen Road, and then to individual homes for some of the elderly that are living homes.
Thank you. So now, Jessica, we'll turn it over to you for the media engagement.
Thank you very much. So we do have some reporters on the call with us, and I'm just going to call them individually, and they will direct their questions as they need to. So I'm going to start with Veronica Waters, who is on the line with us, and I'll just ask that we unmute her line so she can ask her question. Veronica, can you hear us?
Yes, I can. Can you hear me?
Yes, you sound great.
Awesome. Thank you so much. Thanks for letting us dial into this. I think my first question I wanted to ask of Reverend Alexander, who was talking about the difficulty that some people had getting to see doctors. And I wanted to clarify why people are having that difficulty, what they're hearing, and what can be done about that.
Yep. Well, I started getting calls about 3 weeks ago from some of our members and people in the community who thought that they were sick, and they went to the doctor's office and they were stopped at the door. Doctors were refusing to see them and just told them to go home and self-quarantine. My latest call was Saturday night from a young lady who's a member of our church. She'd been sick for about 3 weeks, and she said she had called a number of doctors, hospitals, and clinics, and couldn't get in. She works in real estate, but she also is an Uber driver, and as I understand it, Uber has a program which will help its drivers in this situation. But you have to provide proof that you've been medically quarantined, or it's been recommended that you're quarantined. She couldn't get that. She couldn't get that through a doctor. She did send me a text this morning, and she was able to. And I can't remember the name of it, but she was able to go online to one of the online medical groups, and they were able to talk with her. She took a temperature, gave it to them. And they were able to call in some medicine for her.
Have you heard whether or not any of the calls, the previous callers that you had, have you gotten updates on how they're doing? Have their conditions worsened or have they gotten better?
It's really a terrible situation. And Reverend Hightower's on the line. One of our best friends and former co-workers, he went into the VA about 3 weeks ago, and he had the symptoms, but he did not have pneumonia, so they sent him home. About 4 days later, it had progressed to pneumonia. And so when he went to the hospital, after a day and a half, 2 days in the hospital, they had to induce a coma so that they could go in and clean out his lungs. And, praise God, he was able to come out of the coma later that night, and he began to breathe on his own, and now he's recovering at home. But from what we're hearing, some doctors and some hospitals won't even accept you until you get to the point where you have pneumonia.
Thank you, Reverend. I wanted to acknowledge that Maria White-Tillman with WABE Radio had a very similar question. She's having technical difficulties, but appreciate that response because she was also interested in hearing about patients' ability to get to healthcare. And that was another important one. WSB is on the line as well. Leonard, I think, is with us, and I believe Sophia Choi was with us earlier. I'm trying to see if she's still on the line. Give us just one moment. And we do have, let me see if, let's unmute Leonard for a moment. Leonard, are you with Sophia? Can you hear us?
Can you hear me now?
Hi, Leonard. We just wanted to see if WSB has any questions.
I'm recording this whole thing. I don't know if Sophia has anything. We were interested in hearing from Ms. Omalami. So if, and that would be really good. But I don't know that Sophia's on or off or what. We're in different locations. Yeah, but personally, I'm good.
All right, great. Thank you very much. We also have Jennifer Pasley with us. I'm going to see if Jennifer had a question. Hi, Jennifer. Did you have a question for any of our organizations?
No, but thank you, Jessica.
Okay, thank you very much. We had two other callers. Unfortunately, we don't know who they are, but I'm just going to unmute them for a moment and see if they had a question. All right, go ahead. This is, hello, if you are 678-517, you are unmuted right now. Hello? All right, we're gonna move on to the next one, which is 404 533.
Oh, hello, it's me, Maggie Lee at Supporter Report.
Hey, Maggie, welcome. Thank you for joining us. Just wanted to see if you have any questions for anyone here on the call with us today.
Well, I'm working on a story about evictions. I know evictions are paused right now because, I mean, court is closed and they're not serving eviction notices. But, you know, does anybody see the need for policy to go further, like maybe suspend filings for some amount of time or give some kind of relief, you know, like official relief that could be made available to all renters, you know, not above and beyond what nonprofits are able to provide?
Well, as far as the need, I would certainly agree that there is a need for such legislation. Unfortunately, that's not something that we have control over. Whether that would have to happen at the state level or not, I'm not sure. My guess is that's where it would have to begin. And I would also guess that if legislation were brought forward by the state, that the Fulton County Board of Commissioners, all of us, would be supportive of it. In the meantime, we though have put money in place to provide rental assistance and mortgage assistance.
Maggie, did you have any other questions?
And also this $10 million, I know there's like some local funding that's supposed to be available through the Federal CARES Act. Is this that funding or is it like Fulton County General Fund? What's the source of this funding?
This is total Fulton County General Fund.
Okay, thank you.
And Jessica, I'd just like to add that in relationship to the question about constituents who may be experiencing symptoms, that we do have a COVID hotline that is managed by our Board of Health. And if you have constituents, customers, neighbors, friends who are experiencing COVID-like symptoms, fever, cough, shortness of breath, they can call and speak with a nurse at 404-613-8150 to explain their symptoms and to talk about any opportunities they might have to be tested here in Fulton County. So that's 404-613-8150.
Thank you.
Okay, any further questions? If not, on behalf of the Board of Commissioners, I'd like to thank you for joining us and say to you that if you would like to speak in more detail with me or any of my colleagues